Understanding heart failure for individuals who have recently been diagnosed. Heart failure is the leading cause of hospitalizations over the age of 65. In Canada, the direct cost of heart failure is over $2.8 billion annually. 1 in 5 heart failure patients are readmitted within 30 days of discharge. Heart failure is a progressive disease with relatively poor outcomes. The 1-year survival rate is estimated to be 80 to 90% in mild to moderate cases and 50 to 60% in severe cases. Approximately 600,000 Canadians are currently affected by heart failure. Overall, these statistics don't seem promising. However, there are certain steps you can take to improve your outcomes. First, it's important to understand what heart failure is. The heart is a muscle that pumps blood throughout the body in order to deliver oxygen and nutrients to the surrounding tissues. When this pump malfunctions, the body is deprived of these essential requirements, which can have potentially life-threatening consequences. There are 2 ways in which the heart can malfunction. Systolic heart failure is when the heart can't pump enough blood out to the body. This usually occurs when there's an enlargement of the ventricles, which results in a weakening of the muscle. In contrast, diastolic heart failure occurs when the ventricular muscle stiffens. When this occurs, the heart is not able to expand as easily, which results in a decreased filling of blood. As mentioned before, heart failure is a very prevalent disease. Intuitively, it makes sense that there would be many different causes. Generally, heart failure arises as a common end pathway of many cardiovascular diseases. Hypertension is when blood pressure is chronically elevated, which forces the heart to work harder. This increased pressure also puts stress on the arterial walls, which can cause damage over time. This damage increases the risk of plaque buildup, which will narrow the opening of the blood vessels and can contribute to coronary artery disease. In coronary artery disease, the blood vessels supplying the heart itself are narrowed, and as a result, the heart muscle has decreased blood supply, depriving it of oxygen and nutrients. If a coronary artery becomes completely blocked, this will result in a heart attack. If blood supply isn't restored to that section of the heart, then the muscle will die. These 3 conditions are the most common causes of heart failure and often occur together. However, there are also many other causes. Ultimately, each of these conditions puts increased stress on the heart, which over time will cause damage. Using heart attack as an example, let's consider how heart failure can arise. Imagine you have a garden that gets its water from a hose with 3 branches. If one of those branches gets a kink, water flow will be cut off from that section of the garden. Over time, this section will die. This same logic applies to the heart. A healthy heart beats in unison with a cardiac output of roughly 5 liters of blood per minute. If a branch of a coronary artery becomes blocked by a blood clot or plaque, that section of the heart muscle will die. As a result, the dead tissue no longer contributes to contraction, resulting in decreased output of blood by the heart. The overall outcome of this process is heart failure. The heart may try to compensate for this decreased cardiac output by beating faster. The decreased cardiac output by the failing heart means that all other organs in the body aren't receiving adequate supply of nutrients to sustain their normal function. This will lead to several symptoms associated with heart failure: extreme tiredness and fatigue, weakness, and rapid and irregular heartbeats. The decreased cardiac output causes a drop in blood pressure, which triggers the kidneys to take action. They will try to compensate for the decreased blood pressure by retaining salt and water. This will have a net effect of increasing blood volume. Unfortunately, this can cause more problems. Since the heart is still impaired, this increased blood volume will get backed up in the veins. This results in a condition known as congestion, which causes swelling of the feet, ankles, and abdomen, rapid weight gain, and shortness of breath due to accumulation of fluids in the body tissues. Heart failure symptoms substantially decrease the quality of life of individuals living with the disease. Fortunately, there are many ways to help manage these symptoms. First, it's important to follow the medication regimen prescribed by your doctor. These medications act to counteract the negative impacts of the body's natural compensations to heart failure previously mentioned. Adherence to a low-sodium diet will help reduce the amount of water reabsorption at the kidneys. This relates to the process of osmosis, where water flows from a region of low salt concentration to a region of high salt concentration. Therefore, having less salt available for the kidneys to reabsorb will also limit the amount of water that can be reabsorbed. Overall, this will decrease the accumulation of fluids in the body, therefore minimizing the congestion common of heart failure. Just like your biceps, your heart is a muscle that will respond to exercise by increasing in strength and improving overall cardiovascular fitness. This is important for patients with heart failure as it will help improve symptoms of weakness and fatigue. These same symptoms often lead to exercise intolerance, so it can be challenging to adjust to a more active lifestyle. The key is to incorporate exercise gradually and slowly rather than beginning with intense exercise. The ideal exercise is low to moderate in intensity, such as walking or cycling. Always consult with a doctor before beginning any exercise program to learn how to do so safely with respect to one's individual needs. Additionally, smoking and alcohol use increase risk factors of heart failure such as atherosclerosis and hypertension. Therefore, eliminating these activities will decrease stress on the heart and avoid further impairment. Finally, it's important for patients to continually monitor their heart failure symptoms. This is commonly done by recording daily weights, since rapid weight gain is indicative of congestion. If this weight gain is detected, patients can contact their doctor to adjust their medication dosage accordingly. With this immediate response by the patient, rehospitalization can potentially be avoided. So why is this all important? Overall, improved self-management is associated with increased quality of life and decreased morbidity and mortality in heart failure patients. Studies show that noncompliance with medication, diet, or symptom monitoring can cause 15 to 64% of heart failure hospital readmissions. Every 10% improvement in the use of guideline-recommended therapies has been associated with a 13% lower risk of death among heart failure patients. Thanks for listening, and hopefully you have a better understanding of heart failure and the steps you can take to improve your outcomes.